Seniors over 70, we need to talk. What if the medications your doctor prescribed to help you are actually putting your life in danger? What if those little pills you take every morning, the ones sitting in your medicine cabinet right now, could be silently destroying your memory, increasing your risk of deadly falls, or even triggering heart problems that could land you in the emergency room? This isn't fear-mongering. This is medical reality that 99% of seniors never hear about from their healthcare providers. Here's the shocking truth. According to the Centers for Disease Control and Prevention, 83% of adults in their 60s and 70s are taking at least one prescription medication. One-third are taking 5 or more. But what they don't tell you is that your 70-year-old body processes medications completely differently than it did when you were 40 or 50. Your liver works slower. Your kidneys don't filter as efficiently. Your brain becomes more sensitive to chemical changes. The same medication that helped you at 60 could be poisoning you at 75. A groundbreaking study published in the Journal of the American Medical Association found that inappropriate medication use in seniors leads to over 100,000 emergency room visits every year. That's 100,000 preventable hospitalizations caused by drugs that were supposed to make people feel better. And here's the most terrifying part. Most of these seniors had no idea their medications were the problem. They thought their confusion was normal aging. They assumed their frequent falls were just part of getting older. They never connected their memory problems to the pills they were faithfully taking every single day. Before we dive deeper, let us know in the comments below where you're watching from, your age, and how many prescription medications you currently take. Have you ever experienced unusual side effects that your doctor couldn't explain? We're reading and replying to every single comment with personalized advice and safety tips. And don't forget to like this video and subscribe to our channel for more life-saving health information designed specifically for seniors. Today, we're exposing the dangerous medications that could be silently harming you right now. We'll reveal the 5 most dangerous drug categories that seniors should approach with extreme caution, the hidden risks your pharmacist might not mention, and the specific warning signs that mean you need to talk to your doctor immediately. What you'll learn in the next few minutes could literally save your life or the life of someone you love. Let's start with something that might shock you. The most dangerous medications for seniors aren't the ones you'd expect. They're not experimental cancer drugs or powerful heart medications. They're common, everyday prescriptions that millions of seniors take without a second thought. Medications for sleep, anxiety, heartburn, and pain. Drugs that seem so harmless, so routine, that both patients and doctors often forget how dangerous they can become as we age. The first category we need to discuss is what medical experts call anticholinergic medications. These are drugs that block a brain chemical called acetylcholine. Now, that might sound like medical gibberish, but acetylcholine is absolutely critical for memory, thinking, and muscle control. When you block it with medication, especially in an aging brain, the results can be devastating. Here's what makes this particularly insidious. You probably don't even realize you're taking anticholinergic medications. They're hidden everywhere. In your allergy pills, your sleep aids, your antidepressants, your bladder control medications, even in some pain relievers. Each one might seem harmless on its own. But when you combine 2 or 3 of these medications, which is incredibly common in seniors, you create what researchers call anticholinergic burden, and this burden can literally destroy your cognitive function. A landmark study followed over 3,000 seniors for 7 years. The researchers discovered that taking anticholinergic medications for the equivalent of 3 years or more increased dementia risk by 54%. 54%. That's not a small increase. That's a massive jump in your chances of losing your memory, your independence, and your quality of life. Let me tell you about Dorothy, a 78-year-old retired school principal who came to our clinic complaining of severe memory problems. Her daughter was convinced she had Alzheimer's disease. Dorothy couldn't remember conversations from the day before. She got lost driving to the grocery store she'd been shopping at for 20 years. Her thinking was cloudy, and she felt confused most of the time. But when we reviewed Dorothy's medications, we discovered she was taking 4 different drugs with strong anticholinergic effects. An over-the-counter sleep aid containing diphenhydramine that she'd been using for insomnia, an antidepressant her doctor prescribed for mild depression, a medication for overactive bladder, and an allergy pill she took during hay fever season but never stopped taking. Each doctor who prescribed these medications probably thought they were helping Dorothy, but nobody looked at the complete picture. Nobody calculated her total anticholinergic burden. Within 3 months of carefully reducing and replacing these medications under medical supervision, Dorothy's memory improved dramatically. Her confusion lifted. She started driving again. Her daughter cried when she called to tell us that her mother was back to her old self. The most common culprit in this category is diphenhydramine, which you know as Benadryl. It's in countless over-the-counter sleep aids, allergy medications, and even some pain relievers. For seniors, diphenhydramine is like cognitive poison. It causes confusion, increases fall risk, and with long-term use, may contribute to permanent memory problems. Yet, millions of seniors take it regularly because it's available without a prescription and seems harmless. The second dangerous category is proton pump inhibitors, commonly called PPIs. These are medications for heartburn and acid reflux with names like omeprazole, esomeprazole, and lansoprazole. Brand names include Prilosec, Nexium, and Prevacid. If you've ever had persistent heartburn, chances are you've taken one of these medications. Now, PPIs can be lifesavers for people with serious acid-related conditions. But here's the problem. They're prescribed far too often for far too long to far too many seniors. And long-term use of PPIs in older adults has been linked to a frightening array of health problems that most patients never hear about. Recent research has connected long-term PPI use to increased risk of bone fractures, kidney disease, heart problems, and even dementia. A massive study involving over 70,000 seniors found that those taking PPIs regularly had a 36% higher risk of developing dementia compared to those who didn't take these medications. But the risks go beyond cognitive decline. PPIs interfere with your body's ability to absorb critical nutrients. They can cause dangerous magnesium deficiency, vitamin B12 deficiency, and iron deficiency. They increase your risk of serious infections, including a potentially deadly intestinal infection called C. difficile. Your risk of certain, and they may increase cancers with long-term use. Here's what's particularly troubling. Many seniors are taking PPIs indefinitely for conditions that could be managed with safer alternatives or lifestyle changes. PPIs are supposed to be used for 8 weeks or less for most conditions. But millions of seniors have been taking them for years, often because their doctor forgot to reassess the need for continued treatment. We treated a patient named Frank, a 74-year-old retired mechanic who had been taking omeprazole for over 5 years for mild heartburn. He developed severe fatigue, muscle weakness, and frequent respiratory infections. His blood tests revealed critically low magnesium and B12 levels. His bone density scan showed significant bone loss that put him at high risk for fractures. When we gradually weaned Frank off the PPI and taught him simple dietary modifications to manage his heartburn, his energy returned within weeks. His infection rate dropped dramatically. His nutrient levels normalized. He avoided what could have been a devastating hip fracture and potentially deadly pneumonia. The third category that poses serious risks to seniors is benzodiazepines. These are anti-anxiety and sleep medications with names like lorazepam, alprazolam, and clonazepam. You might know them as Ativan, Xanax, and Klonopin. These medications are incredibly effective for short-term anxiety and sleep problems. But in seniors, they become dangerous weapons that can destroy lives. The American Geriatric Society has placed benzodiazepines on their list of medications that should generally be avoided in people over 65. yet they continue to be prescribed regularly to the age group most vulnerable to their devastating side effects. And here's why these medications are so dangerous for seniors. Benzodiazepines slow down your central nervous system, but in seniors, they slow it down too much. Your 70-year-old brain is already more sensitive to these effects. The medication that might have helped you sleep at 50 could leave you dangerously confused and unsteady at 75. Studies show that seniors taking benzodiazepines have a 50 to 80% higher risk of hip fractures from falls. That's not a minor increase. That's a life-threatening elevation in your chance of suffering a devastating injury. But the cognitive effects are even more alarming. Research published in the British Medical Journal followed over 9,000 seniors for 15 years. Those taking benzodiazepines for 3 to 6 months had a 32% increased risk of developing Alzheimer's disease. Those taking them for more than 6 months saw their risk jump by 84%. The longer you take these medications, the more damage they potentially cause to your brain. We had a patient named Margaret, an 81-year-old former librarian, who came to us after her third fall in 2 months. She'd been taking lorazepam for sleep for over 2 years. During the day, she felt groggy and unsteady. Her daughter noticed that Margaret was becoming increasingly forgetful and seemed confused during phone conversations. Margaret's doctor had prescribed the lorazepam after her husband died, which was completely understandable. Grief can cause terrible insomnia. But what started as short-term help for a difficult period had become a long-term problem that was stealing Margaret's independence and putting her life at risk. Working with her physician, we gradually reduced Margaret's lorazepam over several weeks while introducing safer sleep strategies. We taught her sleep hygiene techniques, recommended light therapy, and helped her establish a calming bedtime routine. Within a month, Margaret was sleeping better naturally. Her balance improved, her thinking became clearer. Most importantly, she stopped falling. The fourth dangerous category is skeletal muscle relaxants. These include medications like cyclobenzaprine, methocarbamol, and carisoprodol. Brand names include Flexeril, Robaxin, and Soma. If you've ever had back pain, neck pain, or muscle spasms, you've probably been offered one of these medications. Here's what makes muscle relaxants particularly dangerous for seniors. They don't actually relax your muscles in any meaningful way. Instead, they sedate your entire central nervous system. They make you drowsy, confused, and unsteady on your feet. Research shows they're no more effective than over-the-counter pain relievers for most muscle pain, but they're significantly more dangerous. The American Geriatric Society specifically warns against using muscle relaxants in seniors because they dramatically increase fall risk without providing significant pain relief. A recent study found that seniors taking muscle relaxants had over twice the risk of serious falls compared to those not taking these medications. They're also associated with increased emergency room visits, hospitalizations, and even death in older adults. But here's what's particularly frustrating about muscle relaxants. They're often prescribed as a supposedly safer alternative to opioid pain medications. Doctors think they're being conservative by choosing muscle relaxants over stronger pain pills. But for seniors, these medications can be just as dangerous as opioids, sometimes more so. We treated a patient named Robert, a 76-year-old retired postal worker who threw out his back while gardening. His doctor prescribed cyclobenzaprine, thinking it would be safer than a narcotic pain medication. Within days, Robert was experiencing severe daytime drowsiness. He nearly fell asleep while driving to the pharmacy. His wife found him confused and disoriented in their kitchen at 3 in the morning. When Robert came to our clinic, we discovered that the muscle relaxant wasn't even helping his back pain. It was just making him dangerously sedated. We stopped the medication immediately and started him on a combination of targeted physical therapy, anti-inflammatory medication taken with food to protect his stomach, and gentle movement exercises. His back pain improved faster than it had with the muscle relaxant, and he avoided what could have been a catastrophic car accident. The fifth and final dangerous category we need to discuss is something that might surprise you: High-dose sleeping medications, particularly the newer prescription sleep aids like zolpidem, ezopiclone, and zaloplan. You know these as Ambien, Lunesta, and Sonata. These medications were supposed to be safer alternatives to older sleeping pills. They were marketed as less addictive, less likely to cause morning grogginess, and more targeted in their effects. But research in seniors tells a different story. These newer sleep medications can cause bizarre behaviors that put seniors in serious danger. Sleep driving, sleep cooking, sleepwalking, and complex behaviors performed while essentially unconscious have all been reported with these medications. But in seniors, the risks go beyond strange nighttime behaviors. These drugs significantly increase fall risk, cause memory problems, and can lead to dangerous interactions with other medications. A comprehensive analysis of over 40,000 seniors found that those taking prescription sleep medications had a 35% higher risk of falls and a 40% higher risk of fractures. The medications meant to help seniors sleep better were actually putting them at risk of life-threatening injuries. More concerning is emerging research suggesting that regular use of these sleep medications may accelerate cognitive decline. A study published in the Journal of Alzheimer's Disease found that seniors using sleep medications regularly showed faster rates of memory loss and thinking problems compared to those who didn't use these drugs. The tragedy is that most sleep problems in seniors can be addressed without dangerous medications. Sleep architecture changes naturally as we age. Seniors need less total sleep and often experience more fragmented sleep patterns. This is normal, not a disease that requires powerful drugs. Now that you understand these 5 dangerous categories, you need to know the warning signs that suggest your medications might be harming you. These symptoms are often dismissed as normal aging, but they could be medication-related and potentially reversible. So there you have it. 5 dangerous medication categories that could be silently destroying your health right now. Don't let your golden years be stolen by pills that were supposed to help. Your life, your independence, and your future depend on taking action today. Talk to your doctor, question every prescription, and remember that sometimes the bravest thing you can do is say no to a medication that's doing more harm than good. Thanks for watching.